Is it visible, the screen?
Yes.
Okay. Okay, so afternoon students. So today we will be revising on the topic of ascites. So from the picture itself, you can just know it, right? Ascites. Uh, this part is a normal abdomen, and this part is the ascites. So from the picture itself, you can just know the meaning of ascites. So in the ascites, what will happen near abdomen? It will swell, right? So fluids will be present. Fluids will be present there inside the abdomen, which is known as ascites, which is not normal. We will discuss about this. Okay. So ascites, what does it mean? It mostly occurs in the abdomen, which is this, the stomach portion. And what happens? Fluid is accumulated, means fluids, water is present inside the abdomen. Understand? So it occurs like this. And accumulation of fluids in the abdomen, which is not normal. Obviously, it's not normal. Okay, so which is known as abnormal. And they build up what? Fluid, which is present in the abdomen. All right. And next is causes. What can be the cause of this ascites? It's mainly because of what? So, what are the causes of ascites? Causes of ascites, it can be because of cirrhosis of liver, which is the main cause of ascites. Because of cirrhosis of liver. Cirrhosis of liver means what? There will be what? The tissues, whatever is there in the liver, right? It will become damaged, it will destroy because of what? Because of alcohol and all that. It's mainly because of alcohol consumption. Okay, cirrhosis of liver mainly occurs because of this one, uh, alcohol. And next is, since there will be cirrhosis of liver, right? Since the liver will become damaged, the liver will become bad. So because of that, what will happen? Like there will be blockage. There will be blockage in the blood flow, which is in the liver. All right. Means whatever blood is flowing in the liver, it will be blocked. Like the blood won't be able to flow properly. All right. So that's why this thing will occur. Next is acute liver failure. So what will happen since all these things are occurring? So obviously there will be damage in the liver also. So that's why there will be acute liver failure. All right. Next cause can be because of cancer, like abnormal in the cells and tissues. So that's why it will occur. Next is nephrotic syndrome. So in the nephrotic syndrome, what happens? We have already studied, right? I think in CRD you have already got nephrotic syndrome. So what do you mean by a nephrotic syndrome? Can anybody tell me? Malvina, can you tell me? Malvina, Vilasha,
Yes, ma'am.
what happens in the nephrotic syndrome?
There will be level protein.
Uh, can you please speak a bit louder? There will be what?
There will be high level of protein
Okay.
and there low level of protein in blood,
What,
and
what?
there will be low level of protein in blood,
And?
and there will be increased level of lipid in the blood and
Okay.
edema. Edema.
Edema.
Yes, ma'am.
Okay. So this thing occurs in the nephrotic syndrome. Okay, so nephrotic syndrome can also lead to ascites. Understand? That is accumulation of fluid in the abdomen. Okay, so these are some of the causes of ascites. Next is risk factors. So, who are at the risk of having this ascites? Who are at the risk of having this ascites? So, first is consumption of alcohol. So, if a person will consume too much of alcohol, what happens? It will obviously damage the liver, right? So, as a result, what will happen? There will be ascites. Next is uh, okay. First, let us discuss here from here exposure to hepatitis, including practicing unsafe sex. So what happens in hepatitis? It is mainly with hepatitis B. Okay, the alphabetical letter B. So in hepatitis B, what happens due to unsafe sex? Like a person is not using like any contraceptive device like condoms, IPLs, all those. What will happen? They will be at the risk of having this ascites. Next is remaining unvaccinated for hepatitis B. So what happens if a person won't take a vaccine at the exact time or at the proper time? It will happen like that. Next is uh, who are like addicted, no? Addicted to drugs and all those. So they are at the risk of having this ascites. Like they consume drugs, right? Because of maybe because of some peer pressure and all those. So what happens? They are at the risk of having this ascites. Next is certain medications that may cause liver damage. So there are some medications which cause damage in the liver. Next is chronic health issues. So because of some chronic health issues also, what happens? Uh, it can lead to ascites, such as what congestive heart failure, like a person with abnormal like function of heart, right? So they are at the risk of having this uh, ascites. Next is kidney disease. So whoever are having a kidney disease, their kidney is not functioning properly and so on. So like this kind of people, like they are at the risk of having this ascites. Understand? Next is consumption of alcohol. We have already discussed. Next is low protein diet. So whoever are at the risk of having protein, no, less protein, let's say for example fish, then soya chunks, alright, then all this egg and all those, like who are having less in number, like less consumption, they are at the risk of having this ascites. And the next is weakness and fatigue, like whoever are like weak, okay, whoever are weak and all those. So what happens, like they are also at the risk of having this ascites. Is it clear?
Yes.
Okay, risk factors done. So this is just I'm just showing you few certain points of alcoholism, like the effects of alcohol. So if a person is like addicted to alcohol, what happens? It will damage like certain kind of like internal organs, such as what? Such as like cirrhosis of liver. In the first bit you can see cirrhosis of liver. Next is damage to brain. It will also affect the brain also, the nervous system will affect. Next is kidney failure. It will cause harm in the kidney also. Next is chronic heart failure, like whoever like are having heart disease and so on. So they are at the risk of having this ascites or yeah, sorry. So these are some of the ill effects of alcohol. Okay, it will damage the liver also. It will damage the liver. It will damage the It will damage the liver, it will damage the brain, it will damage the kidney as well as the heart. So these are some of the ill effects of alcohol. Is it clear? Okay, next is treatment. So how can you like treat yourself from having this ascites? How can you treat it? Next, first is abstaining from alcohol. So abstaining from alcohol means what? Like there should be limitation in consumption of alcohol. Okay, so you should a person should have less amount of alcohol. Next is consumption of low amount of salt. So the person should have, like whoever are having ascites, they should have low amount of salt, such as all those chips and all those, like they contain too much of alcohol. Okay, so these are some of the treatment. Like I have already said, now it's mainly because of having alcohol. So they should stay away from alcohol. And next is consumption of low amount of salt. Like they should have like a less amount of salt. Say for example, they were having like 2 teaspoonful of salt, and for now like they will be having like one or else just half like that. Like they should limit the salt intake. Understand? And they should not have all these junk foods and all that because they do contain a large amount of salt. So that's why it usually occurs. I mean, this ascites occurs because of high amount of salt. So that's why they should consume a low amount of salt in the diet. Okay. Next is paracentesis. In paracentesis, what happens? Like they drain all the waste particles which is there in the abdomen. Okay, they drain all the unwanted things. What happens in this paracentesis? It is mainly done because of two reasons. First is diagnostic. Diagnostic, like in the sense like what to say, like in order to diagnose the condition, like actually like what is happening, what is happening to that person. In order to diagnose that, it's mainly done. Next is therapeutic. So therapeutic means in order to treat the condition. Alright, like in order to treat on how to overcome the situation, on how to overcome the psychics. It is mainly done for these two reasons. Okay. So in this way, parasympathesis, which is known as abdominal parasympathesis or aseptic. Yeah. So what happens? A person is usually asked to lie down, and after that, what happens? The drainage catheter, which is this, it is inserted inside the abdomen. It is inserted inside the abdomen, and what happens? All the drain and what happens? Syringe is already inserted, and with the help of syringe, the drainage catheter is connected. And after the drainage catheter, what happens? It directly goes to the drainage container. So this is the drainage container, and in this way, the fluid is taken out from the abdomen. So this is how the fluid is drained out, or else you can say the fluid is taken out from the abdomen. Is it clear, everyone?
Yes,
Okay, ascites means what? Haboklang, can you tell me?
Yes, ma'am.
Can you tell me what you mean by ascites?
Ascites occurs when fluid accumulation in the abdomen. It is the abnormal build up fluid in the abdomen.
Okay. Okay, next question goes to Darshana.
yes, ma'am.
Can you tell me some of the causes?
Acute liver failure,
Huh?
cancer, nephrotic syndrome.
Okay. Another points, Virginia, can you tell me causes?
Yes, ma'am.
Please tell me.
Cirrhosis of the liver is the most common causes of ascites
Cirrhosis.
due, yes, ma'am.
Cirrhosis,
Due
say,
to
say, say, say.
cirrhosis of the liver is the most common cause of ascites.
Huh.
Due to cirrhosis, there is blockage of blood flow in the liver.
Okay. Okay, good. Next question goes to Jem. Jem, Nuhu. Monica. Monica. Monica.
Yes, ma'am.
Monica. Not able to hear. Nafisha.
Yes, ma'am.
Okay, can you please tell me some of the risk factors?
Consumption of alcohol, then low protein diet, fatigue, then exposure to hepatitis, then frequent use of alcohol, then medications, chronic health issues.
Okay. So low protein diet you mentioned, right? So low protein diet, they should consume what? If
Low protein diet.
no, like the low protein diet, like whoever are having low protein, they are at the risk of having ascites, right?
Pardon, ma'am?
Whoever are having like less amount of protein, they are mostly
Yes,
at the
ma'am.
risk of having this ascites, right?
Yes, ma'am.
So what they should have? They should have what?
Fruits, vegetables, and
No,
grains.
they should have what? Just tell me simple words. If it is low, then obviously they should have what? You have mentioned low protein. So they should have what? High. It's not it. High protein diet. It's not it.
Yes,
Yes.
ma'am.
Means since the risk factors are who are having low protein. So obviously they should have ascites people. They should have high protein diet.
Yes, ma'am.
So I was asking that.
Okay, ma'am.
Okay. So protein in what is in which things protein is there? Can you please tell me, Finisha? In which foods proteins are there? Proteins are present. Finisha, Rashmi, can you please tell me
Yes,
in which items?
ma'am.
Huh?
Ma'am, egg
Egg, then
and meat.
meat, fish. Okay, and meat also is there in fish. Okay, anything else?
Mm, ma'am, popcorn.
What?
Ma'am, popcorn.
Oh, I'm not getting. Okay, in all these things is there. Even you know the Nutrella, soya chunks, they should say Nutrella.
Yes, ma'am.
In all this also protein is there. Like say for example, the patient is not very rich, like they can't afford. So all those uh, soya chunks like Nutella and all like that one so like everybody can buy it. It's not it. So like they can have it because everyone can't afford meat, fish, no? Daily wage earner who are earning like every day they can't afford, so they can have all these kind of things like soya bean and all that. And protein it helps. Okay, protein it helps in what to build up your tissues. Okay. 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 So treatment. Can anybody tell me treatment? Salam Mirza. What can be the treatment?
Yes, ma'am.
What can be the treatment for this?
Abdominal paracentesis or ascites step.
Okay. What do they do usually here? How it is done?
Uh,
From the picture itself, you
uh,
just tell me. The answer is already there in the picture.
to draw off excess fluid.
What is this? Huh? What is this?
Ma'am, I can't see properly, ma'am.
Can you see now? Can you see now?
Pipe is pipe, ma'am.
You are asking me or I'm asking you?
Ma'am, pipe.
Pipe. Oh, that means any
Yes.
pipe, no? Water pipe and all that. Don't say pipe.
Uh,
It's a drainage
tube.
catheter. Catheter.
Okay,
Drainage
ma'am.
catheter. Understand?
Okay, ma'am.
Hmm. So they used to do like this. Syringe is like that. Sometimes they do like this also. Okay, syringe. This is the drainage catheter, and they used to insert syringe like this. Like this also they can take it, and they can do like this also. Understand? Like they can insert the drainage catheter in the abdomen, and after that, the drainage, whatever drain is coming out from the abdomen, it goes inside the drainage catheter container. This is the drainage container. Understand? So it goes like that. Did you understand?
Yes, ma'am.
And it is usually this thing is usually done by lying down in the lying down position. Okay, is it clear everyone about ascites?
Yes, ma'am.
Okay. Okay, if it is clear, then can you please tell me, Sheetal, can you please tell me? Sheetal, am I audible? Sheetal, Yatulika, am I audible?
Yes, ma'am.
Okay. Ascites, if a person is having ascites, which organ is mainly like affected?
Yes, ma'am.
Which organ, which internal organ is mainly affected in ascites?
Abdomen, ma'am.
Okay, abdomen, but what is the main cause? What is the main cause of ascites?
Liver.
Liver, are you sure?
Yes, ma'am.
It is mainly caused because of liver. And
Liver.
if the liver is like damaged, what happens? There is cirrhosis of liver. Okay, there will be damage. the liver will be damaged, and what happens? There will be blockage in the blood flow, and ultimately it will lead to damage. The liver will get damaged. Okay. Okay, then that's all for today's class. Thank you, everyone.